Thank you all so much for joining. I'm really invested in this conversation as a person who's been doing DEI work informally for nearly 15 years, but then formally for the last 7 years, and really seeing the trajectory of what's been going well, what's not been going well, and what are some things that I'm seeing that are common mistakes or pitfalls organizations are finding themselves in while trying to do this work effectively. So I wanted to just consolidate that into a session for you all, and I'm also doing additional kind of work on this in a more in-depth context as well. So one of my fellow DEI consultants who I partner with a lot or collaborated with a lot, we just started and are about to conclude a 4-part series called The Elements of DEI. And we take the elements that are Earth's elements, like earth and water and air and fire, and we translate that into these are the 4 kind of foundations you need to create for solid DEI work. So this is an ongoing conversation that if you kind of like some of the information I present today, there's additional opportunities to engage with me in terms of training, consultation, all of that as well. That being said, just a quick introduction about myself. My name is Regan Byrd, and I'm an anti-oppression speaker, trainer, activist, and consultant. And I have been, again, doing work with Regan Byrd Consulting for about 7 years now. I support organizations with understanding the theoretical pieces of this work. So what is racism? What is sexism? What is classism, ableism, et cetera? So how do we deepen our theoretical understanding of those? And then how do we translate that theoretical understanding into practice? So what does this mean in terms of transforming our hiring practices, our team building, our external programming, our collaboration and advocacy with other organizations? So I really specialize in bridging theory and practice. I'm deep on both sides. I spent 15 years in nonprofit operations, developing policies and procedures and evaluation mechanisms. And then now I kind of take that knowledge and again, support organizations pretty much at the beginning or the end of the spectrum of activities you might be involved in. We'll have some time for questions and some more discussion about that at the end of this presentation as well. So before we can even talk about what's going wrong in DEI, let's make sure we're clear on what DEI even is as a kind of approach to work and to running an organization. So when I talk about DEI work, I talk about first anti-oppression, and that's why my title is an anti-oppression trainer, consultant, et cetera. So when we talk about why aren't our organizations and our communities and our society, why isn't that already diverse, already equitable, already inclusive? What is going wrong? What's the problem? The root issue is oppression and oppressive systems. So the root issue that we're trying to deal with is the existence of racism and sexism and ableism, et cetera. That is the reason why DEI work is necessary. DEI work is an organizational tool set for achieving anti-oppression. Anti-oppression is this umbrella way that I want folks to understand DEI. It's the root problem, it's the root kind of approach. And to me, DEI work doesn't work well, first and foremost, if we're not grounded in an anti-oppression mindset. So does DEI work make your organization more money? Yes. Does DEI work help your employees work better together? Yes. Does DEI work make you more attractive in terms of media and publicity? Yeah. None of those are the reasons we're doing the work, though. Those are ancillary benefits of doing DEI, but really DEI is about your commitment to anti-oppression. It's saying we as an organization don't want to contribute to oppressive systems. We don't want marginalized people within our organization to be harmed by our practices. And we don't want our customers, we don't want the community we're serving to be harmed by our practices. That is, I'm going to talk about values in a little bit, but that needs to be the foundation of this work. Yes, it has some other ancillary business benefits to it, but really it's about harm reduction. And you cannot really understand why we're doing DEI work or why it's necessary without that anti-oppression lens. So again, I consider DEI an organizational, institutional tool set and language for achieving anti-oppression. And then it is only one component of justice and liberation work. So again, this is an organizational kind of tool set. It's something businesses and organizations need to do to contribute to liberation work. But there's also trauma and healing work that's happening on kind of the individual level. There is also community organizing work that oftentimes is informal. It's taking place outside of like the nonprofit industrial complex, or it's taking place outside of formal organizations. So informal community organizing is a piece of this liberation work. There's also transformative justice and conflict resolution. So having more healthy ways to be in conflict with each other. That's one of the reasons work that we're doing often breaks down is unhealthy and destructive conflicts that we have in community or in our organizations or between organizations. Those are other components of justice and liberation work. So DEI is one component of this broader kind of commitment, and it sits under this umbrella of DEI. It sits under this umbrella of anti-oppression. When I say diversity, so diversity, equity, inclusion is what DEI stands for. When I say diversity, I think of it along three parameters. So there's diversity of thought, different philosophies, different ways of thinking about all different kinds of like ideologies, right? So different ways of thinking about friendship and family and professionalism and good outcomes and health and wellness, all different kinds of ways of thinking that come from like your cultural background, that may come from your religious or spiritual practices, that may come from different, again, philosophies or metaphysical kind of ideas that you've been exposed to. So diversity of thought is one component of diversity. Another component of diversity is experience. So this is different lived experiences that folks have. So growing up in a rural community, growing up in a community that's outside of the United States, different lived experiences in terms of different types of jobs people have had, different types of community service people have done. There, you can think about the breadth of all of these. There's literally limitless possibilities in terms of diversity of thought and experience. So those are two components. And these are the two uncontroversial components. Like a lot of folks get that, understand the value of that. But a third component that is important is also diversity of identity, especially marginalized identities. So people who have marginalized identities, again, in the US, thinking about people of color, thinking about women, thinking about people with disabilities, thinking about members of the LGBTIQA+ community, thinking about low income and working class folks, et cetera. These are folks that have been excluded from our organizations and businesses, excluded from participation through a number of different dynamics. And these are folks we also need to be attentive to in terms of internally, again, how are we removing barriers for these folks to be able to access and participate in our organization? And also these are folks we need to have in mind in terms of the external programming, like the effect of the work that we're doing on the community that we're serving. We need to keep harm reduction in mind for these folks as well. So this is also a component of diversity, and it's why we're often talking about marginalized groups when we talk about diversification. These are folks that have been excluded. These are folks that face barriers, and it's a component of diversity that, again, connects right back to that anti-oppression piece I talked about earlier. Inclusion, some people will pull out belonging as a separate component. So you might see DEIB. I've always understood belonging to be inherent in inclusion. It's hard to include someone if they don't belong. It's hard to belong if you're not included. So I consider that a pretty critical component of inclusion, but sometimes people will pull it out to have a specific focus on that. So inclusion is about belonging. And what that means is you feel like you are a part of a team, that you are integrated into the organization. Your skills are valued, your expertise is valued, your contribution is valued. And then there's also kind of a social component. You feel welcome. You feel like you are also valued as a human being in terms of your connection with your colleagues, your fellow coworkers, that sort of thing. So all of that is a part of belonging. And then, like I mentioned, integration. You're integrated into the work environment. Again, your perspectives, thoughts, opinions, contributions to the work environment are valued. That is a piece of inclusion. And then this is a critical component that often is sometimes missed when we talk about inclusion, but it's fundamental to anti-oppression work as well as allyship work. This is a phrase that comes from the Black community specifically, and then I think it's been adopted by lots of other communities as well. I believe we originated it. I'm actually not sure, but it is a common phrase in the Black community. And it's nothing about us without us. What that means is those who are directly affected by something, you're directly affected by a decision, by a policy, you need to be at the decision-making table. So if you are directly affected by something, you actually need to be brought to the decision-making table. This is a basic principle that pretty much 75–80% of our society does not do. It's presumed that people at the top of a hierarchy or people in leadership can make decisions for those who are directly affected by a decision without their input. And then we're so many times, like in community organizing work or anti-oppression work, we're trying to go back and fix this. Well, why didn't this work with this community? Did you ask them if this was going to work? No. Well, you could have saved yourself some time if you had checked in with them before you implemented this. Or why are folks upset that, they weren't invited to this conversation? Well, they're upset because their input was not factored in to how this was designed. And then most of the time that leads to harm. This is why this is a problem. Again, harm reduction. If you don't do that, most of the time there's something harmful that happens. Not all the time, but most of the time. So inclusion, we need to have folks who are directly affected by decisions at the decision-making table. So let's say your organization is switching its healthcare plan. Hey, the premiums for Kaiser went up and we're looking at now United Healthcare, and somebody in management or the CEO or the executive director is like, yep, this looks good. I'm going to sign off on this. And I, as a consultant, would come in and say, no, you need to pause. We need to take this to the employees that this decision is going to affect, and we're going to give them some information. Here's our current policy. Here's the new policy we're looking at. We think the benefits are comparable, but I want you to read through this, and we're going to come back and talk about what are your concerns with shifting this. Same thing if you're, you can think of this in any kind of like organizational decision-making that impacts your staff. You want to do that same thing. Have some time set aside to be able to, this kind of change management. If you've ever had classes or information on change management, you want to let people know why the change is necessary. You want to give them a chance to react to those changes, talk about their concerns, and you want to revise and modify what you're doing based on those concerns to have the best possible outcome. So you need to do that with any decisions that are affecting not only your employees and your staff, but also, again, the community that you're serving. Keep this in mind in terms of your external work as well. So we're going to implement this new thing. Let's do a focus group. Let's do a survey. Let's do a town hall. Let's have some kind of conversation with members of this community to make sure, again, it's going to have the effect or the impact that we think it's going to have. And then equity, equity is the biggest one. So this is kind of where everything else that is not diversity and inclusion kind of gets captured. So equity, again, thinking about this through this anti-oppressive lens, equity to me has a couple of core components. So number one, this is about the difference between equality and equity. Let me actually kick that back to the audience. Does anyone feel like they have a really good definition of the difference between equality and equity? Yes.
My understanding is that equality means everybody gets the same thing, and equity means everybody gets what they need.
I think that's a great definition. I'll expand upon that in a moment. Thank you. Other folks, anybody want to add to that definition? Yes.
I just one time saw a graphic of a fence. I love that graphic. It really helped me put it in my mind. And there were children trying to look over the fence, and there were different sizes of boxes to help them see over the fence. And the idea was children of different heights don't need all the same size of box to see over the fence. They need their own size of boxes to see over the fence, in case you haven't seen that graphic.
Absolutely. So a lot of people have probably seen that graphic. of the boxes with the fence. And I think that's a really good kind of starting place to talking about the differences between equality and equity. So as you said, equality is kind of everyone gets the same thing. Everyone goes through the same process. Everyone gets the same resource. And we're going to call that fair. It's about what is fair, what is just. Our definition of that used to be just equality. Give everyone the same thing. That's fair. That's just. Equity has us make an adjustment on what is fair, what is just. We're taking into account a couple of different considerations. So equity, as mentioned, we first take into account what people need. So that means what does someone need in order to utilize or actually access this resource? You'll see accessibility there, which we'll talk more about in a minute. So what are people's needs? So with that fence example, one person didn't need a box because they were already able to see over the fence. Another person needed 2 boxes in order to see over the fence. But that other piece is the goal or the purpose. Why are you giving people resources? It's to achieve something, right? Why do people need resources in the first place? To do what? To achieve what? That's the other kind of consideration with equity. What are people's needs and for what purpose are we providing them? Programming or resources, anything like that. What is our end goal or purpose? So in that graph, infographic, the purpose was to get people to see over the fence so they could see the baseball game. So we're taking into account that goal, that baseline, and then we're saying, what do people need to achieve that? And in the image, we have the same 3 boxes. So your resources are actually the same, but instead of giving everyone 1 box, now we have one person has 2 boxes, one person has no boxes, another person has 1 box, but you're able to have 3 people see over the fence rather than just 2. Your outcome is better using the same resources. You're not being asked to put any additional resources in, but you're being more effective in your use of resources. So that is equity in general. Now with anti-oppressive equity, there's a couple other things that I have folks keep in mind. Number 1, we need to remember that some communities have been denied resources historically. So we're all not starting on the same ground, right? Some folks have resource deficits as a result of oppression. So you need to keep that in mind in terms of folks' needs. It's actually not just individual needs, which that graphic can actually erroneously emphasize that point. Like this is about individual needs. It's about individual and community needs, both of those at once. So remembering that some communities have been denied resources. Also, this is going back to this piece of inclusion. It's not just about folks witnessing something happening to them, right? Make sure that they are able to participate in this process as well. Have people reflect back to you what their needs are. Try not to make assumptions about needs, have them tell you what their needs are. So there still needs to be an inclusion piece in equity, doing equity well as well. And then let's remember that it's also not just helping people circumvent barriers. It's not giving people resources to simply overcome barriers. You're actually trying to dismantle barriers. So this is fundamentally equity, but there's some additional considerations around dismantling barriers that have, again, have to do with oppression and oppressive systems. So let me give you an actual definitive example of that. This is an example that the Chinook Fund, for those who are familiar with, this is an example that they use for their community granting. It's called the Giving Project. So they bring community members together to raise money and then grant that money out to nonprofits. So they use the example of, let's say there is a nonprofit who wants to work on supporting people in communities with asthma. And so their work is they decide to do direct service, and we're going to give out inhalers to low income folks who may not be able to afford inhalers. And then that's going to be like a core part of our work is making sure people have access to inhalers and asthma medication, things like that. So they say, that's great. Like that work is useful, important. That's going to have an effect on people's lives. What we're looking for is organizations that are taking it one step further in terms of equity and in terms of getting to the root of solutions. Again, not just helping people get over barriers, but dismantling those barriers. So what that would look like is, if we're looking at this community that has a lot of people that have asthma, and we actually look to their neighboring area, and we see that there is a factory that is producing a lot of smog and air pollution. And this seems to be related, we know statistically, it's related to why a lot of people in this community have asthma. So if your organization only is thinking about providing people inhalers and you're not looking at the root cause of asthma and disparities there, they would say you're not quite going far enough. We might actually choose to fund an organization that's doing some support work, but also is doing advocacy work, is also trying to get that factory either moved or changing their process so it's producing less air pollution, or passing some laws or policies with the state legislature to get some regulations. That is the deeper level of trying to get to the root of problems and understanding, again, oppression. We know communities of color are more likely to be in communities with more exposure to environmental toxins and hazards. That's called environmental racism. If environmental racism is not part of your analysis, you're missing a big piece of what your work can be doing and how you can actually be having a greater and longer impact. So equity, we want to think about the community impact of our external work. How are we creating lasting changes, long-term changes? How are we getting to the root of problems? So you need to think about that in terms of, again, whatever your external work is, whatever your programming is, whatever you're selling, whatever your work in the community is, think about having an impact that creates long-lasting and deep solutions for folks. And then again, thinking about accessibility. This is another one that sometimes people will pull out. So you may have seen IDEA, and that's diversity, equity, inclusion, and accessibility. I think that this is a component of equity. So if you don't see it, that doesn't mean that this is not a consideration. But accessibility, in terms of giving people individualized or customized resources, again, that box analogy, these to me are the three components of equity. There are some other things we could talk about in terms of anti-oppression, but these are kind of some fundamentals around just thinking about DEI. Let me pause there. Any questions about some of these definitions I've gone through?
Could you define oppression?
Yes.
I know.
I'm trying to think of if I have so the simpler definition is harm happening to individuals and communities based on their identity. And then when I say harm, more specifically, it's ideological, institutional, interpersonal, and internalized harm. So that's the 4 I's of oppression. But it's harm that happens to people and communities based on identity. And those identities basically are constructed as inferior or lacking in some way, having some sort of fundamental flaw. And then that affects how they're represented. That affects how policies are written about them. That affects how people treat them. It affects their internal psychology and even physiology. So that would be my kind of 2 definitions. You're welcome.
Can you say that 4 I's more slowly?
Yes. So I do a whole training on this, and it's called the 4 I's of oppression, if folks are interested in that. So it's how every oppressive system operates. It is the full answer. What is racism? The full answer to that is the 4 I's of oppression. So again, it's ideological oppression, institutional oppression, interpersonal oppression, and internalized oppression. You are welcome. There is an invisible 5th one that's a parallel to internalized oppression. It's called internalized dominance. And it's basically how people in privileged or dominant identities, the things they internalize about themselves, how their psychology gets affected by being in a part of a dominant or privileged group. But the 4 I's is normally you just talk about those 4, and then you could talk about some distinctions with dominant groups within those. Yes.
Do you feel like justice fits into equity as well?
This also is related to me saying DEI cannot exist without anti-oppression. So justice is a component of anti-oppression. If you're doing DEI correctly, then justice is baked in with you having that anti-oppression lens. So I do like, first of all, I like the term Jedi just because you can do all those fun Star Wars analogies and stuff like that. And I do like that to me, it's like an organization trying to say we have a higher values, like dedication. Like it's not just about doing this internally in our organization. It's about, are we contributing to justice in society? So I don't mind when people pull it out, but I don't like make it a requirement just because I'm like any and all DEI work should have a justice component to it. And then if you're not doing it through this anti-oppression lens, to me, you're still missing some core components, but anti-oppression brings in that justice element as well. When we talk about values, that is also a place where organizations can kind of distinguish like what is the reason we're doing this work? What is it that we care about? So you can also like have values that speak to justice as well. Basically it needs to show up somewhere, but it doesn't necessarily need to be its own acronym for me to know that that's showing up. All right, we have time for maybe one more question. Any other questions at this juncture? Okay. So let's start talking about some of these errors that are showing up in DEI, common mistakes. Number one is trying to treat DEI like it's a department. And I see this all the time. And that probably sounds familiar to many of you. So DEI is not a department. You can have someone in charge of DEI. You can hire a vice president or a president of DEI, something like that. There are things that I don't like about that model, which I'll talk about in a moment. But basically, treating DEI as a department means people are like, it's their job to think about this. It kind of sequesters DEI work as it's not my responsibility as an administrative employee or as a programmatic employee to know anything about this or do anything about this. That's that department's responsibility. And actually DEI, the reason it's not a department is there has to be a DEI component in what every department does. Everyone has a part to play in this. Everyone needs to have a contribution to it. You can go as far as baking it into people's job description. This is what your contribution to this organization's DEI work is. So think about that with an administrative professional. Well, how would they contribute to DEI? As an administrative person, if I'm selecting vendors for catering or for buying paper, some of the ways I can contribute to DEI are, I'm going to look for local vendors. I'm going to look for vendors that are from marginalized communities to try to support those businesses. I need to make sure that I'm meeting employee needs in terms of our catering. So I need to make sure I have a vegan option and a gluten-free option, et cetera. I was for a group called Transformative Alliances. They were doing a health equity training series, and they needed someone who had both administrative and event planning experience and an anti-oppression lens. And they're like, we just want to give the job to you. We don't know anyone who has this blend of experience. And the reason that they needed someone like that, so I just acted as a contractor for them for a couple years. They needed someone to think about that because think of all of the ways you need to think about accessibility when you're planning an event. So not only was it catering choices I was making, but we had non-binary and trans participants. I needed to work with the hotel to make sure that we could label bathrooms as non-binary or gender all-inclusive, so they had a bathroom to use. I had to work with folks to make sure that we had folks with disabilities that could not get up on a bed that was situated too high. So I had to know the layout of the hotel rooms to make sure that their bed was accessible. I had to think about the temperature, like, do we have temperature control of the room? Because some folks have peripheral neuropathy or neurological diseases where if the room is too cold, they literally can't participate. It's going to be too uncomfortable. Those are just some of the accessibility considerations I had to have, but I had to be aware of the different identities that I was going to need to think about it through that lens, and then arrange, hotel and facilities to meet those needs. That is DEI as a holistic component of your organization. Everyone knows what their contribution to DEI is. It's not just sequestered into one department and only that department is in charge of thinking about it. So when you have someone who's like your vice president of DEI, that's what they're then in charge of doing. They actually have an organizational broad role. They need to be connecting with every single director of every single other department or every single manager. They need to be giving them tools and strategies for each of their functions or roles. They need to be basically an expert on anti-oppression and how a lack of equity will show up in different components of, again, the community you're serving or in terms of your organizational work. So that's a huge role. If you have a director of DEI or a DEI department, they are supporting all other departments, just like you might consider an HR department doing something like that. I'm going to talk about why DEI is also not the HR department. They're two different things. But this is a big mistake I see a lot of folks making. One last thing I'll mention is that the reason I don't like the employment model as much as the consultant model for this, or I at least think you should have some kind of third party support, is because when the director or whatever of DEI has to challenge power and leadership structures, when they're like, actually, the way leadership is making decisions is problematic, actually we have some power imbalances where this is showing up, those folks can get shut down real easily because they are employees. So it's like, I don't want you working on this anymore. I don't want you talking about this anymore. And we'll fire you if you don't do that. That kind of ties their hands about really being able to do this work authentically. That can still happen as a contractor, as a consultant. But since you're not my only client, I have a little bit more power and flexibility to challenge you. And I can come in and say, this is why you hired me, to tell you this stuff. So if you're really going to get that upset about it, what's at the root of that? Where's this anger and being upset coming from? Let's explore that. So I have a little bit more power as a consultant to cut through power dynamics than an employee does. So this is something else to keep in mind with this component.
I think we're seeing that model fall apart right now. We're seeing a lot of those folks quitting or getting let go.
Absolutely. You've seen the whole, like in media industries, they let a whole slew of folks go. People will narrowly define the job role in a way that's like, I'm not even doing any equity or any inclusion, anything. I'm just doing diversity of hiring and recruitment. That's 10% of what my job should be. And I mean, like, think about, Coca-Cola, which I like Coke as a drink. I just want them to be a better company. But you think about them and they have a DEI officer and like, they're just like, yeah, tell us how we can like make sure our employees feel more welcome. And, I'd be like, can we talk about like how we're stealing water in like South America and how we're like harming indigenous communities and how we're like stealing like local water and stuff from like Mexico? Like, we're causing harm in the communities that we're in. Is that a part of this work? No. That's what Coca-Cola would say. So the employment model is, really running into some issues because it's even the way the job descriptions are being crafted, it really it doesn't have that justice and that anti-oppression component that it needs to have. All right, mistake number 2, treating DEI as HR. These have two different functions in your organization. DEI should not be under HR. HR has a DEI component to it, like every other department. So HR may be in charge of some of your hiring, interviewing, recruitment processes, some of your team building processes, and they're doing that through a DEI lens, but these are not the same. Why? Because HR has a different lens on which it's looking at the organization. So HR is very risk averse on purpose. It's trying to minimize your exposure to lawsuits. It doesn't like things that it thinks are, again, why would we do something that's a little more risky than just not do that? HR is trying to make sure you're in legal compliance with stuff. So many times that's the highest level they'll come up to. Hey, we're experiencing microaggressions and folks are feeling harmed based on sexism and racism and promotional decisions. And HR will come in and say, well, we're legally compliant. Okay, that's not quite the question, though. The question is, are we causing harm? Are we doing something out of alignment with our values? HR sometimes will struggle with that because they are trained and designed to think through this legal compliance threshold. And then also HR has a role in protecting the organization. So HR comes in as like, how do we make sure the organization continues to exist? How do we protect the parameters around the organization to make sure the organization doesn't dissolve or fall apart? And that's an important component. But if that's the only consideration that's happening, you can see how that can entrench harm to employees that have less power, less access. HR can often say, it's actually not good for us to admit that we've done something harmful. It isn't good for us to admit that we've had sexist hiring practices. That opens us up for legal things, and that opens us up for this. So HR is going to come and advise from that perspective. You need a counter department or a counter narrative to say, so HR, we want them to give us some guardrails, but also we're also here to talk about our values, what we care about, harm reduction. So we do need to admit that we've done something sexist because we said we're not going to try to do that. We have done it. We need to repair that. We need to figure out how we're going to repair the harm that we've caused to employees or whatever. We need to figure out how we can stop that from happening again. So DEI and HR, they have different roles, different functions in the organization. When HR tries to do DEI, it ends up almost always defaulting to its primary considerations. And then again, there's a lot of harm and frustration that can come to employees. HR continues to shut me down. HR continues to not address leadership and ask leadership to make changes. HR continues to talk about, well, nothing illegal is happening when that's not what I'm saying. This model has also gone wrong in a lot of different cases. Number 3, no values foundation for the work. So again, this work, you have to have a deeper values commitment to this work. I oftentimes come in and tell organizations, here's what anti-oppression will ask you or help you think about as an organization. What is it you care about in your organization other than money? So I know you care about money, but money really at the end of the day is a tool. Money helps us do something else that we care about. It helps us give people good salaries. It helps us buy better equipment. It helps us increase the scope of our programs. Value, money isn't really its own value. To me, it's actually a tool. But a lot of organizations treat money as if, we're just trying to get more money. We're just trying to get more income. We're trying to get more grants, et cetera. They treat that like that's their main purpose. But I'm like, your organization exists for a reason. You're trying to create a change of the world. What is that change? What kind of world are you trying to build? What's your vision for the world? Again, what do you care about in relationship to that vision? My favorite question, what is it you owe to the world, to your community that you're serving? What is your duty? What is your responsibility? What do you owe to the community that you're serving? So those are questions that can help you set a values foundation for your work. You got to care about something other than money. And most of us do. Most individuals, most organizations do. Organizations are made up of individuals. And most of us would not cause, if it's an individual decision, would not cause an exorbitant amount of harm or death to a community just because it makes more money. That's what our organizations are doing, though, right? A lot of organizations are causing harm to people up to and including death for the purposes of making more money. But the underlying dynamics of why that happens is this. There's no values foundation driving the organization decision-making. The only thing that's driving organizational decision-making is money, and you have to separate that and have a deeper commitment to something. So DEI work will not go well if you do not have a values foundation, because ultimately your values are what you're going to hold yourself accountable to. If you don't have any values, if you haven't articulated that, if you haven't onboarded your employees with that knowledge, then it's not going to be a component in your decision making. And you're going to find yourself making decisions for the wrong reasons, because it makes you more money, because it gets you more prestige, etc. Having no time allotment and no budget for the work. So acting like this work doesn't need additional money granted towards it. And that might be employee or staff time. That might be, again, hiring consultants. But not having a budget for the work, this work is just going to somehow fall into place without any intentionality around it. And then not giving people enough time to work on it. So many organizations are like, oh, we have, a DEI committee. And I go and talk to the committee and they're like, I'm supposed to be doing all this DEI work on top of my 40 hours a week, on top of my other responsibilities. And I basically keep getting told, if you don't have enough time, let the DEI work slide. Or it takes us 6 months to get something done because we're in the busy season. And my organization really cares mostly about what I'm producing. It doesn't care about the DEI work as much because it won't give me the time and the money to do the DEI work. Lots and lots of consultants will come in and say, show me your budget, because that's going to show me what you care about. Where are you spending your money? That indicates what you have given value to. If I don't see DEI work anywhere in there, that means you don't really care about it. It means you have not allotted time and resources to do that work. So many organizations fall into this pitfall not allotting enough time or budget to do the work. It needs to be incorporated into the 40 hours a week of your employees. What that means is you spend 30 hours or 35 hours a week on your other responsibilities, but I want you doing 5 hours a week on DEI, or, 10 hours a month on the committee. That would be, you're spending money on that because you're spending money on employee hours, and you're giving them the time and space to actually get that work done. Or again, having a budget to hire a consultant if you want to go that route, et cetera. But it needs to actually show up in where your organization is contributing resources. Number 5, DEI is a nice to have. So we do DEI when it's convenient and when we have time and when we come back to it at the end of the year being like, oh yeah, we need to talk about DEI. We haven't done anything with that all year. Are we going to do like a book club? Are we going to like watch a movie and do like a discussion about it? Are we going to do like a little like staff meeting dedicated to DEI? And thinking of it as an extra or as a nice to have, rather than it's fundamental to your organization's role and responsibility. So DEI work is not a nice to have. It is, if you are not doing it, if you are not doing anti-oppression or DEI, you are causing harm, period. I can promise you, I can demonstrate how you're causing harm. It is fundamental to how your organization should be operating, should be thinking. So it's not extra, it's not a nice to have. It should be baked into your operations, just like safety is, just like internal controls around your finances are baked into things that you do. DEI needs to be considered a fundamental component of your organization, not an extra or a nice to have. Thinking of DEI as professional development. So I keep running into this a lot, where folks get a training and then they're like, oh, great, we had a Regan Byrd training and that was fun and that was great. On to the next training. Let's do a training on time management. Let's do a training on different kinds of food practices we can have in our staff meals. Let's do et cetera. And they're treating it just like it is useful general information that can enrich the employees, understanding of something, and is kind of, again, like it's like you treating it like a lunch and learn kind of series thing, rather than, again, baking it into the work of your organization. And this is actually information that everyone needs to know and to understand, to be able to implement, to be able to practice. So professional development, this can get a little gray. I understand that, because there may be some people who want to learn and grow in this work while they're in your organization, but do not think of it as professional development, as useful things to know as you're doing your work, because it's not that. Again, it's fundamental to the impact and the running of your organization. It's fundamental to everything you're doing internally and externally in your organization. So I'm running into this a lot. And it's really about consuming stuff, like you're in a consumptive space. We consumed this training, done with that. What's the next thing? We're on to the next thing that is interesting or that we've heard about. So being mindful of being in a consumptive kind of place with it as an organization, and then making sure that you are integrating the knowledge that you just got from a training or something, and that you're putting that knowledge into practice. A couple other ones. So there's 10 total. Not going deep enough or being too surface level in the work. And what that means is, again, only wanting to talk about hiring and recruitment, not wanting to talk about all these other areas you need to consider. Not being willing to dive into things that will make people uncomfortable. And we'll talk about that as another component. Not wanting to challenge leadership and power structures, not getting assessments from general staff on the impact of the work environment or what's going on in the work environment. So really trying to box in the work in a narrow kind of scope, and not allowing the work to go where it needs to go in terms of what's showing up in our organization. Again, what's causing harm and what are we going to do about that? So a lot of folks are too surface level with it. They want only the stuff that's easy, only the stuff that's comfortable, only the stuff that doesn't challenge fundamental organizational structures and operations. Number 8, no vision and metrics for success. You do need to have parameters to measure your success in this work. So how do we know that we're anti-racist as an organization? What does that look like? How are we getting feedback from those who are affected by racism? Because they need to be a part of the folks who tell us whether we're being anti-racist in our operations and our programming and all of that. So basically allowing the work to be too amorphous when actually DEI work resembles, good DEI work resembles strategic planning a lot of the times. You have action items, you have milestones, you have performance indicators, you have an end goal and vision for what you're trying to shift or change. And then when you have those, you can go back and evaluate how well you did. So are we doing what we said we're going to do? And what are the data pieces that we're looking at that'll help us ascertain and measure that? And it's not just quantitative, it'll be qualitative too. So again, surveys, interviews, conversations, all of that can be a part of your metrics and evaluation. Conflict, fragility, and fear of emotion. Being really, really scared of conflict. Yes. And this is a big component of something called white supremacy culture, if you've heard of that, which is a business operating norm or business operating culture that many of us have inherited or adopted. And it's about what's considered professional, et cetera. So conflict, fragility, or fear of emotion, feeling nervous about folks, feeling uncomfortable or feeling discomfort in the work, not creating structures and systems for folks to do healthier generative conflict, et cetera. So conflict, fragility, and fear of emotion, this work will bring up conflict, and that's okay. That's a part of our growth and learning and our expansion in this work. So we don't need to run away from this, and this can cause a lot of issues. And then finally, having a revolving door of consultants, like not investing in consultants or one or a few of them that get your organization, understand your organization's history, can grow with you as an organization. Most organizations don't go through accountants every year because they want some institutional and year-over-year knowledge. They don't go through lawyers every year. DEI consultants need to be considered the same kind of thing. You want someone who understands your institutional history and can grow in that with you, and someone whose philosophy and approach to the work matches and works well with your organization. So you don't need to keep having a grab bag of different consultants. Pick some folks that really are in alignment with you, whose expertise and perspective and values match your organization or excite you as an organization. You want to grow with them, and then retain them so they can build with you that long-term strategic plan, that year-over-year institutional knowledge. I think I wanted to have about 5 minutes for questions at the end. So just wanted to say that this is kind of what I've been talking about, this cycle of anti-oppressive practice. You need to have this values foundation. This is what your organization basically needs to do on an ongoing or cyclical basis. So you want to have a values foundation. You want to have a theoretical understanding of what the problem is. You want to translate that theoretical knowledge into practice, and you need to be evaluating your practices. This is what your organization is going to do on an ongoing cyclical basis year over year. And then finally, these are all the areas of organizational practice that need to be taken through a DEI anti-oppression lens. Recruitment, hiring, onboarding, team building, training and professional development, funding sources and budgets, employee, volunteer, and board resources, leadership structure and decision-making, communications and marketing, vendor relationships, conflict resolution, offboarding, external programming, and your external advocacy and collaboration, your connection with other organizations who are in your same sector or who are doing the work. So thank you. That concludes my presentation. This is my Patreon information for individuals to contribute to work that I'm doing. And then also I have some exclusive Patreon events and things like that. This is my email, Regan at Regan Byrd Consulting, if you want to reach back out. And then I think someone is going to need to come in and set up. I didn't think about that. I was thinking about ending at 11, like right at 11, but someone else needs to come in and set up. But while they're doing that, I can probably answer a few questions if y'all we're at 10:53. So if y'all want to have a few questions answered before we go to your next session.
So like the people in this room, right? We very much love this.
Yeah.
But for people outside this room who are trying to get in this space but maybe feel intimidated or maybe they're not the decision maker, would maybe the Patreon be a good place to kind of start learning this information to start bringing back to their organization? Or for people outside this room, like, what can we do to help them get to be one of the people in this room?
I really think having I think starting at the organizational level is, you can either start at the individual organizational level. So sometimes individuals need coaching, need counseling in order to address their defensiveness and resistance to the work. So you can start there. It depends on the place that they're in. Or you can start by saying, hey, this is mandatory training, or this is something that everyone needs to learn. You're going to do this in a group setting first, and then you're going to be able to determine what's coming up for you or what you're struggling with. And then it might lead into individual support that way. But essentially, they need exposure to what this work is about. Because so many people are like, I don't even understand what DEI work is. I don't understand why it matters to me. I'm not racist. I'm not sexist. So what does any of this have to do with my job and my role? And they need to understand how it's happening at the societal level, how it does show up in organizations, and how if they're not thinking proactively about it, they will contribute to it. They will cause harm because they are coming from, they are like, people don't exist in a vacuum. We are influenced and are coming from the society that we are, that influencers are thinking. And then, if you're not proactively addressing barriers are going to come up and limit people's access to different resources and things. So you need to give them opportunities to understand why this work matters, what it has to do with them as individuals. That can start organizationally or it can start individually, but you're trying to first, like, you're trying to get them to start here.
Right.
Why do I care about this work? Why does it matter? And then, well, what is racism? What is sexism? How does that show up in the world? They're going to follow this same kind of pattern, the same kind of cycle that organizations are going to follow. They need to care about it. They need to understand what it is. They need to understand what they can do about it. They need a way to revise and evaluate their work.